Hello friends, I am Dr. Ritu, IVF specialist in IVF Patency, Delhi. Today we shall talk about blocked fallopian tubes. So first let's know what is the function of fallopian tube. Each female has a uterus, two tubes and two ovaries. The length of fallopian tube, also called as the uterine tube or oviduct, is almost around 10 cm. It has a fixed proximal end where it is attached to the uterus and a free distal end where it lies close to the ovary. Tubes have a very important function in natural conception. Almost 30 to 35% cases of infertility because of tubal block, or you can say 1/3 cases of infertility are because of blocked fallopian tubes. Every month, a woman releases an egg from the ovary, which is captured by the fallopian tube. Once it enters the tube, numerous sperms will surround it. One of the sperm will enter the egg and fertilize it. Fertilized egg will remain in the tube for around 4 to 5 days. Tube will provide the environment for the growth of the embryo and will also help to move the embryo towards the uterine cavity with the help of ciliary and muscular action of the fallopian tube. Once the embryo reaches the fallopian tube, it gets implanted on day 5 and pregnancy occurs. So if patient has a blocked fallopian tube, sperm and egg can never unite and pregnancy is almost not possible. Now, what are the causes of blocked fallopian tubes? It could be infections, most commonly pelvic inflammatory disease, which could be caused either by tuberculosis or sexually transmitted infections like chlamydia and gonorrhea. Infections post-abdominal surgeries, post-abortions, and medical termination of pregnancies. Other causes could be endometriosis, previous tubal surgeries, previous ectopics, smoking, and sometimes fibroids can also impinge on the tubes and cause blocked fallopian tubes. So what are the symptoms of blocked fallopian tubes? As such, there are no symptoms. Patients will usually be diagnosed to have blocked tubes during evaluation for infertility. But they can present with symptoms of the causes, like symptoms of PID, endometriosis, and patients with hydrosalpinx rarely can complain of profuse vaginal discharge. So we discussed about the function of fallopian tube, causes of blocked fallopian tubes, symptoms. Now what are the types of block? It could either be a proximal block that is close to the tube, to the uterus, or it could be in the middle or the distal end, and sometimes the fimbriae is severely damaged, which is called as fimbrial block. So now how do we diagnose tubal block? The most important fact is the history. You have to take history suggestive of any infections, tuberculosis, PID, endometriosis, dysmenorrhea, dyspareunia. Because if any of these factors are there, patient is considered to have high risk for tubal block. The two common tests used for tubal patency evaluation are HSG, that is hysterosalpingogram, and hycosi. In HSG, we use X-ray films, or you can say we use X-ray pictures for evaluation. We first instill the dye in the uterine cavity and then capture the pictures. If there is free spill from the fimbrial end, tubes are considered to be patent. If tubes are found to be open during HSG, it is considered very accurate. But if tubes are blocked during HSG, the test is not considered very accurate. Because evidence has shown that 6 out of 10 cases who have blocked fallopian tubes on HSG will turn out to have open tubes on either a re-HSG or a laparoscopy. The next test is hycosi, where we use ultrasound instead of using a X-ray. So it helps us to diagnose both adnexa and uterine pathologies also in the same sitting. And if you combine it with a 3D ultrasound, it improves the accuracy of the test. Patients who have history suggestive of endometriosis, pain abdomen, dysmenorrhea, we should rather use laparoscopy for tubal evaluation, because we can also use the see and treat policy and treat the endometriosis in the same setting. It has been seen in evidence that if patient has one fallopian tube which is patent and there is no other cause of infertility, then chance of conception is fair, almost as a patient has both the tubes open. Now the next important point is how do we manage blocked fallopian tubes? So there are two ways of management. First is surgical and second is IVF. Surgery cannot be given an option to all patients. So patients who are young, who have no other cause of infertility, who have only minimal blockage and most of the length of fallopian tube is normal, can be given an option of tubal surgery. But patients where tube is massively damaged, prolonged duration of infertility, other causes of infertility like decreased ovarian reserve, abnormal semen parameters, previous history of ectopic, previous history of tubal surgeries, advanced maternal age, should be offered IVF directly. Patients who have been offered IVF, in case they have a hydrosalpinx, it has been seen by evidence that hydrosalpinx decreases the implantation rate or pregnancy rate by 50%. So it has to be dealt in before the embryo transfer, which could be either by salpingectomy, that is removing the tube, or by tubal clipping. Now the last and the most important question every patient has is, can blocked tubes be opened? So the answer is that all types of block cannot be opened. But if a patient has a proximal block, then we can attempt hysteroscopic proximal tubal cannulation and try and open the tubes. So today we discussed about blocked fallopian tubes, causes, types, symptoms, how to diagnose and how to manage. If you have any questions regarding blocked fallopian tubes and infertility, please feel free to contact on the number flashing below on the screen. Thank you. Have a nice day.